Folks, it's Tim McMenamin from FarmRight. We're located in Charleston, South Carolina. And today what I wanted to share with you was a bit of information, thanks to Dustin and his efforts to bring us together and build a community around the needs of this community. We're excited to participate. I wanted to share with you some of the challenges that folks are encountering around medication management, and particularly home medication management, but up and down the care continuum, post-acute care, and then ultimately share with you a bit of our vision and how we got to spending time and energy over the last few years trying to address these challenges, and then share a little bit of information with you about the actual device and software and services that we provide to help address the challenge. The challenge in medication management is, of course, that value-based care is changing the way we pay for healthcare and deliver healthcare. And as a result of that, we're all looking for new ways to improve home care. And ultimately, there is I think you're all aware that there's a very significant rise in the occurrence of chronic illnesses. And the numbers are really staggering. And I can share some numbers with you on our website, but won't bore you with those today. But tens of millions of people in the US are not fighting one, but multiple chronic illnesses. And of course, one of the affordable ways that physicians and providers are helping to pay for treatment or support treatment, provide treatment to those chronic illnesses is actually by prescribing multiple medications. So in the past, while a patient may have taken 4 to 6 medications, it's actually not uncommon for a patient to literally be using 8, 10, 12, 15 medications every day to treat multiple chronic illnesses. And of course, I think all of you working in this area see often the realization that whether it's cognitive challenges, simply the challenges of aging and memory loss and or challenges there, or literally just truly the challenge of a fully cognitive individual trying to manage, multiple dosing periods with multiple medications, going through a sorting process on a weekly basis to try to make that simpler, and all of those issues. Complicating that is, of course, the aging of America. The baby boomers are changing from caregivers to care receivers in the coming decade. Medication adherence is actually contributing billions of dollars to the total cost of care. And you again see this because if somebody fails to take their medications or over-medicates, it often leads to a physician visit at least, sometimes a readmission at worst. It perhaps leads to a fall that then requires hospitalization, that then requires step down in rehab, and the cycle begins again. So ultimately, I'm preaching to the choir here because I think folks working in this area understand. But this, of course, is at the same time that labor costs for care management and nursing services are rising rapidly, and we're looking for creative ways to address that. And ultimately, the realization that there's no single solution that's going to solve the adherence problem. If this was something that a procedure could address, of course, our health system would have prescribed it years ago, but unfortunately, that's not the case. So our vision at FarmRight, we actually grew up in the medication management automation space and worked for decades in hospital, in acute care settings where hospital pharmacies and nursing systems can cost millions of dollars, but ultimately have been designed and implemented to close some of the error gaps that exist in the acute care system. It's not uncommon to walk into hospitals in America today that use some kind of automated storage and retrieval system in the central pharmacy. Sometimes that's robotics, sometimes that's automated carousels, a variety of products and tools used there, but used to assist in storing and picking accurately. And then, of course, up on the care floors, very common now, some 90% of US hospitals now use bedside barcode scanning systems, which match the caregiver's ID to a medication barcode and to a wristband with a barcode on it. I think we've all experienced that for ourselves or with a loved one. So we saw that there was huge need in the home care environment, but ultimately the products that were available, well, we respect everybody who's paying attention to this, were not of the same kind of professional grade and quality that we saw in acute care. So we took to developing Livi 1.0, the first version of our smart pill dispenser. The device was introduced in late 2017. Of course, we secured FDA Class 1 device listing and also engaged with an ISO certified manufacturer to help us build quality devices. We demonstrated proof of concept in the consumer market, frankly, because the businesses were still catching up a bit, still not in the position to drive this kind of new automation into the market as quickly as we needed. So we actually opened our website and began selling commercially. We've sold hundreds of devices, initially at about $2,000 a device. Fortunately, the price is coming down on that device, but we've been able to use that market to test our proof of concept with now over 1 million devices, with over 1 million doses dispensed and a lot of very, very good learnings from folks who most often in the consumer space are actually family caregivers trying to keep a loved one in their home a bit longer, or ultimately defer medication management, nursing services in the home a bit longer, and ultimately have gained success there. Now the business-to-business market is taking off. Pharmacies, providers, payers are all looking ways to help address challenges in this space, and things are taking off a bit more aggressively. That being said, we've also worked on developing our Livi 2.0 device, which will reduce the overall cost of the device and make it more available to those who need it the most, but also will increase its telehealth capabilities. Currently, it's a connected device. It looks like a Keurig. I wish I had some nice slides to share with you, but perhaps Dustin can help me distribute those to those who are interested after this presentation. It's a very attractive Keurig-like device that sits on.
I do have I pulled up your website and I've got your website shown.
Thank you. Thank you. I sure appreciate that. Ultimately, we made the design decision to provide cellular connectivity right out of the box. So when the device arrives in the home, you remove it, you have scheduled a concierge setup service with our folks that get on the phone with you, and we spend about an hour removing it, setting up the device and the dosing periods for the medications, and off it goes. Literally, by turning on the device, it reaches out and hits a cell signal. There's no additional Wi-Fi or connectivity needed, nor do you need to purchase any additional cellular services. Those are bundled into the cost of the system. So that indeed, if your loved one or in your business, your clients don't have Wi-Fi, it would not prevent the use of the system. The solution itself comprises multiple components. We talked just briefly about the device, and I'll dive more into that, but it also includes a cloud-based software product capability, which allows caregivers, whether those professional or family, actually access information about the device remotely. And the reason this is helpful, of course, is when you deploy a Livi device, it literally, you can set up notifications so that the caregiver is notified on a variety of data points. And initially, often caregivers, when first deploying a device, will actually kind of turn all of those on to see how the patient is adapting to the system, whether the behavior changes are occurring, and they can use that data to help nurture them through adoption. But what typically happens then is as they get comfortable with it, they begin to be able to ratchet back on those notifications. And for instance, literally simply get to a place where if the patient or client doesn't take their medication, they receive a notification. So now it's an opportunity to engage with the client and say, hey, how are we doing this morning? Are you up and at it? Have you taken your medications? You know, let me help you. Let's talk you through, you know, that process. And ultimately, all of the data collected from all interactions with the system are stored to an audit trail, and for data collection to keep an eye on adherence. Recently, CMS began, Dustin, to require data collection of adherence data around 4 chronic illnesses. They're collecting that data from basically from information from claims data to see if a patient actually fulfilled their prescription. That's the data they're using to help improve adherence. Well, needless to say, there's a long distance between filling your prescription and actually getting it in the position where you can, you know, dispense and take the medication. So we're seeing providers and payers now an uptick in use of Livi's because they can literally see on a daily, a weekly, a monthly basis which patients are having trouble with adherence and can engage well before they get anywhere close to losing reimbursement or now enduring penalties that CMS is beginning to demand for lack of attention to medication adherence. So we're seeing a lot more interest in this kind of solution. Let me talk for just a moment about the use cases that we're seeing folks utilize Livi for most often at this time. And there's a number of in effect, you know, customer challenges in different settings that are prompting use of Livi. I mentioned the pharmacy. The pharmacies, long-term care pharmacies, specialty pharmacies, even retail pharmacies are looking for new ways to engage and secure customer business. We've seen a change in consumerism in the pharmacy space with the recent acquisition of PillPack by Amazon. You know, a strip packaging solution that provides active adults the opportunity to, you know, have their 8 a.m.s pre-packaged together, their 12 noons in a separate package, and they can literally pull off the strip what medications they will need, and they can take meds with them if they're off to work or off on a weekend activity. Great solutions, really, for what I would call active adults. But ultimately, the market segment that we're addressing are those folks who really have a much deeper clinical need and often will need what are referred to as PRNs or as needed medications, or even some controlled substances to help sleep, for pain, etc. Livi provides a locking compartment with a metal key and barrel lock, and any removal, whether with the key or through forced entry, is actually captured and audited, and a notification can be sent to the caregiver or family members, one or more, to let them know that the device is being opened, simply as a precaution or frankly as a critical, you know, barrier to perhaps others coming in and out of the home or accessing meds inappropriately. So that's a helpful thing. Ultimately, what we're seeing is that pharmacies are looking for, again, ways to engage with patients to provide additional value-added services. And the data that Livi collects also gives them clinical insights around adherence, provides them with tools for medication reconciliation, and of course, they're hoping bonds them more deeply with high need, high risk patients, which are important to help them grow their business. I talked a little bit about the move to value-based care and how payers and providers are looking for ways to improve adherence. Their critical success factor is, can we move the needle on adherence? Can we get patients or groups of patients to take their medications? And can we get data from that to know where we are and help manage them? The other market that's growing perhaps most rapidly is the intellectually and developmentally disabled space, where state Medicaid programs are encouraging the movement of clients from institutional care to group home care, and group home care to independent living. And medication management is sometimes the actual tipping point, is the critical success factor. They have all the other tools to move to a group home, or they have all the other tools to move to independent living, but they're managing 10 or 12 medications and they need some support. So we've seen a good deal of uptick in that environment. We're also getting a lot of interest from telehealth and Internet of Things, IoT vendors, who are providing home security systems historically, but now are beginning to branch into medication, diagnostics and data collection in the case of the IoT folks, or telehealth providers who have been looking for creative ways to engage patients in their home and provide additional services, and equally important, collect information that can be helpful in providing and improving their care. So a lot of strong interest there. Of course, telemedicine got its first real driving uptake in rural and more remote environments, but now we're seeing telehealth being applied in even urban healthcare systems, where simply engaging with patients without having to have them come into the office saves everybody time, money, and energy. And then the last large area is the opioid treatment environments, where we're seeing significant uptick because of some of the control functions that we have, both in the hardware I talked about, but also the software, which captures data about every interaction with the system and can identify if patients, or at least identify patterns, if clients are jimmying the system to try to gain access to additional medications. In that environment, there's one specific use case called medication-assisted treatment, where they're using a number of medications which are kinder and gentler and less addictive than opioids, and are using those medications and dispensing them through Livi's at time-accessed intervals, and being able to help provide folks with treatment in their home, which is certainly cheaper than having to have them come in on a daily basis to an office to pick up those medications, or of course in some situations in inpatient treatment environments. So those are a few of the cases. Of course, the one that perhaps is most notably missing are aging in place communities, who have demonstrated great interest as we engage patients first in an independent living environment, their own apartment with perhaps some access to nursing care or services or other meal services, et cetera. And then as their care requires, being able to move them through a continuum of care to a variety of assisted care environments. But unfortunately, that market, while we continue to engage with lots of folks, has really not taken off yet. I think folks are stepping back to wait for data and or demonstrated, hard dollar ROI to move forward. So we're looking forward to, engaging with some innovative thought leaders in that space who might be interested in doing some pilots with the Livi system. I will just take a moment here and close with just a couple of minutes here with differentiation. You may know there's a number of devices on the market today. Again, we deeply respect everybody and anybody working hard to help keep patients in their home, because we think it's critical to actually, reducing costs in the healthcare system. If we're really going to get our arms around cost and quality, we all have to do a better job of helping folks in group or in independent living environments. And so great respect to them. But where we believe we're differentiated is that our backgrounds were in that acute care environment where errors are critically important, reducing errors, and where the use of equipment has to be proven over not days of use, not weeks of use, but years of use. So we actually implemented, technologies and even mechanical capabilities within the system with, really large real-time to failure durations. Our system is a little bit harder to set up, but ultimately we believe and feel confident it will run longer, more consistently over a period of time. We approached it from a unique perspective in that it wasn't simply about home care and making it easier for the patient and their family at home. We really designed it in hopes that professional caregivers would implement Livi as well. And so you'll see that there's dashboard capabilities. If you're supporting 12 or 15 or 50, you can literally get a dashboard view that helps you triage and focus your energy on the places, on the patients, the clients who need it the most. Those who are running along without any trouble, you can take the data you see as an opportunity to reinforce their good behavior change. But ultimately, if somebody's struggling today, it prompts an opportunity to give a call and see, hey, what's going on there today? Is it really just we forgot, or we took a walk at the wrong time today and we were away from our machine and missed the reminders? Or were we actually, didn't get out of bed today, and there may be a larger or more significant problem there. So some good capabilities there. And then ultimately it can run in standalone mode as a one-off, like I said, as a consumer, or it can be integrated with a pharmacy or a business that is providing other services. And frankly, that's our ideal market, where folks providing services in this space actually integrate Livi as one component to perhaps a larger service model, and using the data to help inform those other services as well. If you've seen the website, you've probably seen that one of the things we bang on pretty hard in our messaging is the fact that our capacity is uniquely larger than all the other devices. We actually can truly support up to a 90-day supply of up to 15 medications. And as I mentioned, the 15 medication thing is a growing phenomenon. But the 90-day supply, in effect, provides you the opportunity to avoid all that error-prone sorting that occurs each week, or in the case of group homes or institutional care, where literally you're having your medication certified staff, using pop-out bingo cards or bubble packs, and doing a lot of medication prep, which is error prone by nature in that care setting because of the workload, because of the pressure of being in the trenches, all of those things. So we're seeing that group home and even some institutional care environments are using Livi to frankly provide support to their staff. So it simplifies the medication pass. Or in the home where a patient or family caregiver can easily access the right medications, different meds, different dosing times. Again, pain medications, if you're allowed to take 2 every 4 hours and you only take 1, it will make the other one available until that window closes. Often those have a maximum of X number every 24 hours. It will close the patient out from getting more medications. Some literally hospital level dosing capabilities now available in a home system. So those are important things. And then in addition, I mentioned the security, both physical and software security, to make sure that if there are breaches of the system, that's being documented. It's creating an audit trail so you can go back and take a look and see what's happening, and often put together patterns that are either the need to change behavior, or frankly, that indicate that perhaps some pilfering of medications is occurring. And then lastly, the system provides inventory control capability. So it's actually decrementing. It has sensors that indicate when medications are dispensed, and will decrement, and can actually send messages to family caregivers, professional caregivers, or even the pharmacy to say the medications are running low. And then a second one later, all configurable by you to indicate that the medications are critically low. And pharmacies like that because it allows them to schedule refilling of the canisters and taking advantage of that. So again, if Dustin, I want to provide some time for questions, and I see my time here. So shall I come up for breath and take a few questions, or?
Sure.
Okay.
Yeah, absolutely. Thank you. That was a very good overview. Anybody that has questions, go ahead and throw them in the chat box there. I have a couple. So are we're looking at the device right now with the lid off, and where you can see all of the compartments, medications in them. Is one device used per home, and can the device dispense drugs for multiple individuals living in that home? So in that group home environment that you were talking about, it can dispense medications for if there are 3 people living in the home, or would you need a separate machine for each individual?
You do. Our friends at the FDA are very, very concerned about the use of a single device for multiple patients. We have become aware in the consumer market that some off-label use of the system is being implemented. Of course, in that environment, we provide the system, and the consumer, configures and utilizes the system. There's some people who are literally using these for supplements only, and in that case, we are aware of at least one user who, a husband and wife, have all of their supplements stored on. They've set up separate dosing periods so that each of them gets their supplements dispensed. But in clinically relevant settings, the FDA really does not want cross-contamination, the small risk of cross-contamination, and other issues. So good question, but I would, yes.
And then, so a big thing that I wanted to make sure that people caught was that, and correct me if I'm wrong, is that a pharmacy can fill these pill bottles, essentially dispense the pills from the pharmacy. You take these bottles back to the home, to the dispenser, and plop them in, right? So it's
Yes, really good distinction. Our favorite use case is that environment where, even if it's an intellectually and developmentally disabled environment, a group home or independent living, we're partnering, we're bringing the third leg of that stool to the table, and in the form of a partner pharmacy. And the partner pharmacy is actually helping to measure and configure the pill dispensers. All of the complexity, frankly, or much of the complexity, I shouldn't say all of it, but much of the complexity is actually in the canister. It has a pill singulator and makes sure that only one pill dispenses at each time. And those are easily configurable. We liken it to Legos. You literally, put a red one, a blue one, and a green one together to match that pill size. And so we actually have the pharmacy stepping up to say, why don't we take on that component? And then a pharmacist check occurs to make sure that it's dispensing correctly. And then the pharmacies will fill those canisters. And we are currently using kind of a common swap model, where if they have, let's say they get 12 medications, and again, depending on the pharmacy, they may be replenishing every 30 days, every 60 days, every 90 days, depending on what model works best for the group home, the independent living environment, the client, etc. And so in that environment, they're literally filling those canisters in a controlled environment to the pharmacy. They're putting on a tamper-proof strip of tape, and they're labeling it clearly. So it's they're placing those multiple medication canisters into an envelope, and they're sending those off, whether that's some retail pharmacies, of course, would like you to come in and pick those up because you'll spend a few extra dollars in their pharmacy while you're there. Others in the IDD space are actually delivering those consistent with current kind of group home models. And so the 15 medications come in, the caregiver swaps those canisters out and sends the empty ones back. And in that case, what's really unique, if you're looking into the bowels there of the containment area there, is there's a technology being applied there that won't allow you to put that canister into the wrong location. There's a RFID chip in the canister, and if you go to put that in the wrong location, some other empty location perhaps, it literally will beep at you and direct you to place it in the right place. So there's some nice security or safety capabilities that were built in there to help assist, again, the safe use of medications in those environments.
Very, very neat. Matt, I remember being at a DSP, and it would have been, you know, when you have a state surveyor coming in to and watching during a med pass, that DSP is always so nervous about making a mistake, and this just takes that. Well, and just the error of medication errors. I'm sure there was a huge reduction in those as well, right?
Right. And what's fascinating, Dustin, is the folks who are on the front line, they're frankly the ones who most know the challenges, right? When people say, yeah, but how do those caregivers react to having technology? They're typically thrilled because they know that they still have a certification that they have to protect, and they're still the last ones. Nurses know that they have a state license that requires them to check off on different steps in those processes, et cetera. But all of us like the idea that there's an extra safety net there to help us out. And if there's a problem, point that problem out and notify me early in the process so that a true adverse drug event doesn't occur. We know those are expensive. We know they can be physically, very difficult or actually disastrous for our clients. Nobody in the care environments, want that to happen. So they're typically really supportive and tend to work through whatever kind of behavior change or culture change is required to adapting the new technology.
Man, you guys have thought this all the way through, and great device for those closed door long-term care pharmacies out there. You guys probably want to go take a look at this thing. So, well, Tim, I appreciate you jumping on here and doing this. If there's any questions for Tim, you can throw them in the chat box there real quick. But Tim, we'll let you get back to Hawaii. Happy anniversary. Thank you. Thank you for getting up so early and joining us on that special time with you and your wife. And very neat what you guys have put together here.
And again, Dustin, our thanks to you for creating this community and bringing us together to learn and to support and nurture each other. We're all in this one together, and it's really going to take this kind of, effort to move the needle. So thanks for your efforts there, and I'll make sure that you've got a deck to forward on to others who might be interested in seeing some additional information.
Perfect. All right. Well, thank you, Tim. Thank you, Marie, who's not on anymore, our first presenter. And thank you all for joining us. We do have a tech huddle next week. So join us next Tuesday at 12 o'clock for some more solutions, and go hit disabilitycocoon.com. We've got some cool things coming up. So thanks again, Tim.
Thank you. Happy day.
All right. Have a good day. Thanks.